Welcome to the Orthodontics and Summary Podcast, where Farooq brings you the key points and understanding of orthodontic webinars, conferences, and papers in a concise podcast with your host, Farooq Ahmed.
Welcome to part 2 of Nikhilesh Vaid's lecture entitled Class 2 and Growth Modulation, So Near and So Far. So in part 1, we summarized the first half of the questions, and now we're going to go into the second half from this lecture. So it started off by asking the question, well, is dental alveolar correction worth it for our patients? The answer Nikhilesh Vaid came to is that yes, indeed it is. However, it's only if it is a stable outcome. We also have to take into account the compliance of our patients. So in our removable appliances, Nikhilesh Vaid's meta-analysis showed that 19% of patients are not compliant when it comes to this form of treatment. So we have to bear in mind 1 in 5 won't complete treatment. The next question was the use of Class 2 elastics. Now, there was a comparison between a fixed functional appliance of Forsus versus Class 2 elastics. Interestingly, both reached the same clinical outcomes for the overjet. However, there was a difference in duration, with the Class 2 elastics taking up to 7 months, whereas a fixed functional appliance took about 4.5 months. Now, there are some side effects from using Class 2 elastics. They can cause extrusion and palatal tipping of the upper incisors, also quite noticeably a clockwise rotation to the occlusal plane. Now, interesting, when compared to the fixed functional Forsus appliance, it was the opposite. It was an anticlockwise rotation. Nikhilesh mentioned ideally for Class 2 cases, we really want an anti-clockwise rotation of the mandible taking place, as they help to resolve the Class 2 component to patient's profile. The next question was about off-the-shelf Class 2 correctors, the Myobraces. Well, there are two papers Nikhilesh looked at. One by Idris in 2018 that showed conventional activator appliances are more effective than off-the-shelf appliances in the order of 1 millimeter. However, there is a cost benefit in favor of off-the-shelf appliances such as Myobrace, which Cirgic showed in 2018. Question 12 asked about future growth, and currently there is no consensus about what future growth will take place for these patients. Equally, therefore, relapse is an unpredictable outcome for Class 2 correction. Now, Harvold advised after 6 months of appliance where things are stable. However, Nikhilesh questioned this, and his recommendations are for 1 year of appliance use, and that's to minimize abnormal or reduced growth, also to account for immature bone, and to minimize relapse as a direct consequence. The last question Nikhilesh asked, well, what is the criteria for success for these patients? And he quoted the Franchi and Bacchetti classic paper, where they looked at patients who had cervical spine maturation level 3, had Class 2 molars, but also were reduced in their vertical component. Nikhilesh's conclusions were that there are no advantages from early treatment. There is no difference in self-esteem for early versus delayed treatment. We know that 20% of patients, 1 in 5, aren't going to complete our removable appliance therapy for Class 2 correction. Headgear and Frankel appliances are limited to dental alveolar change, and patients have a preference for fixed functionals. And Nikhilesh left with new questions to be asked, and what he would like to know the answers to is, where are his patients on the growth curve? And also, do we require pre-functional appliances, and how does it affect our growth and long-term outcomes? That's it for this episode. Hope you have enjoyed it, and if you do like the episodes, please do subscribe and look forward to the next episode.